Physical and Occupational Therapy. You will begin moving within hours of your surgery. This is going to help speed up your recovery and prevent complications. We strongly encourage your coach to attend your first therapy session so that they can also learn safe transfers. A member of our physical therapy staff will work with you on safely being able to use your walker, get in and out of your bed, car, or chair, and show you how to safely get up and down stairs. They will educate you on which positions should be avoided following your surgery and help assist in a safe discharge plan for your individual needs. The most important restriction for knee replacement patients is to never place a pillow under your operative knee. If you need to elevate your leg, do so by keeping your leg straight, not bent. We do encourage you to periodically bend your leg to help prevent stiffness, but leaving it propped in a bent position makes it hard to get your leg back to full extension. For hip patients, your precautions or activity restrictions will depend on the approach used during your surgery and your surgeon's orders. To prevent dislocation, certain hip precautions will help avoid motions that place pressure on the weakened area of the joint capsule after surgery. We will review if you have hip precautions based on your surgery approach post-operatively and make sure you are aware of motions to avoid before moving. Precautions will not apply to every hip replacement patient. You may also see an occupational therapist before you discharge home. This member of our team will help assist you in managing your activities of daily living, such as dressing yourself and transferring in the shower. Your therapy team is a very important part of your recovery. You will continue physical therapy following discharge from the hospital. This is continued and reevaluated at your follow-up with your surgeon to stay consistent with your joint replacement goals to ensure that you are healing successfully.